Mr. Downing.
Thank you very much, Madam President. Through you members, I rise in opposition to the amendment, and I want to address several of the points that have been brought up so far. First of all, I think there is absolutely broad agreement, no matter what party you're affiliated with in this chamber, no matter what section of the Commonwealth you come from, around the need for and the role that prevention and electronic medical records and any number of different important steps that are taken in this bill, the collection of information and transparency for consumers and customers, that all of those steps will play in reducing the cost of health care, both in the short term and in the long term. I think we all agree on that, and so I think the question before us is at what speed do we move forward with those, and how will we fund those steps. On several occasions during this debate, both Tuesday and today on several different amendments, I have heard members of the Senate say that organically there is something going on in the private marketplace, as if this Senate has been sitting on our hands for the past 5 or 6 years, ignorant of the issue of health care costs in the Commonwealth of Massachusetts. I will tell you that I don't believe that anything has been going on organically in the marketplace. This Senate has taken steps since the passage of Chapter 58 continually to try and get at the cost of health care. Because no matter where you go, to the smallest communities, to the biggest communities, to those served by incredible teaching hospitals, to those served by rural community hospitals, no matter if you walk down through Downtown Crossing or on North Street in the city of Pittsfield or through our smallest towns, rural downtowns, you hear about the cost of health care as being a detriment to our cities and towns, being a detriment to our small businesses, to our larger businesses, being a detriment to our economy. So I think what is happening in the marketplace right now in Massachusetts is happening because of the steps that this Senate, this administration, and this legislature has taken. Does it mean that we have done everything perfectly? No. Nor does it mean that we have done nearly enough. And I believe that that is why we are here debating this bill today. So I think it is not entirely true to say things are happening organically in the marketplace. Does it mean that we should be careful to make sure that we are pushing forward the good while holding back the bad? Yes, absolutely we should, and we should do so with all due diligence and deliberate debate. I believe that the bill that is for us helps us make sure that we are bringing together the best parts of what is happening in the marketplace and making sure that we expand on those and that we build on those. So again, the question becomes, how do we better fund those efforts? We all agree, we all know that prevention and investments in electronic medical records and the collection of information to better inform consumers and promote transparency at all levels is absolutely at the core and critical to everything we need to do to reduce health care costs here in the Commonwealth. So the question is, how do we fund it? I believe that the proposal put forward by the chair of the Healthcare Financing Committee is a measured way to fund those absolutely critical initiatives that we all know we need to continue to move forward on, not as some fairy tale hope for the future of how we will reduce health care costs, but meaningful ways that we have seen across the Commonwealth in targeted fashions that now need to be expanded to better fund what we know we need to do to continue our laudable efforts around access and universal coverage while making sure that that coverage is as cost effective as possible. So Madam President, I support the assessment as it is in the bill, and I hope the amendment is defeated.